Well, I'm hoping I can start by asking the first questions of Anne, and then she can definitely ask, a question or two of me. Just for a little background for folks, how long we've known each other since 2016, I think. Is that right? Is that when you were here?
Was it 20? I think, yes.
Something around when Pamela Collins was interviewing. If you go all the way back to when Pamela Collins was interviewing for the director of the global mental health thing. And of course, now she's gone on to Hopkins. But Anne and I have had the opportunity to do some work together and then talk a lot about our own work. And many of you may know, but there's just not as many people doing child and adolescent work as there is adult work. Like even here, there's a few people do child and adolescents, but I get excited when I hear about students doing that work because so often their focus is adults. There's a lot fewer people on children and adolescents. And some of you may not know this will be my first question for Anne is, I think Anne has such an interesting academic journey because she was a teacher and then came to academics. And so I've always wondered, Anne, because we haven't talked about this directly, what role does and I'm not sure if you taught primary or secondary, but what role for you as a teacher in schools, how does that play into how you think about what children and adolescents needs in terms of mental health care and the role of schools?
Thank you very much. And I'm glad to be here. It is true, my journey started as a teacher, and I taught in a number of Kenyan schools, high schools, therefore interacted a lot with adolescents. And what I can say back then, for one reason or the other, I was always interested in guidance and counseling. And I didn't have a formal training, but had to go for short courses until I became a head of Department of Guidance and Counseling. And what was most interesting is that as I taught, there were these students who, for one reason or the other, had problems. And the problems now mostly maybe behavioral problems. And when you got the children, they always talked of my parents. And I am like, I'm a parent as well. So is that what mine are saying? Parent and parent. And of course, the number of problems being in Kenya and in those areas. So there were a number of things. Either there aren't enough resources, there aren't enough. And so the child would I know what one time you have to campaign to get pads for others, and you tell students, don't go home if you've got some leftovers, don't go with them, just bring, because they're students who are needy. And more important, I can also remember training as a teacher was you keep discipline. And sometimes if it takes a lot of thinking, all right, that time we could cane, now we are not allowed to cane. But then you also realize that, are there my colleagues? You are not very trained, but are there my colleagues who go overboard in terms of relating with problems of a child? You listen as you take tea break. You are you are hearing the student, the parent, the teachers complain unnecessarily about the student behavior, and you've got what is normal misdeeds of a student who is growing up. And this needs you take yourself back to when you're growing back up, and you think, oh, didn't I do some of those things? And it's normal, and then we take it. So from there, anytime I got an opportunity to go for training in guidance and counseling, I did that. And with time, I was made the guide. The last station I taught, I was the head of Department of Guidance. And when they realized I didn't have enough skills to do this, and then there were evening programs had been introduced, I went to do a counseling psychology, and I wanted a master's because already I had a degree, but I was told, the best thing is you start. And I'm glad I started there because in the process, I got to get clinical psychology. And then I finished and I said, I'm going for clinical psychology. And that again made me now even better. And we could discuss with the parents and where they come with these high expectations. We had a system, we called 844. And those systems were like, you must pass and you must go to university, mindset of you must pass. So the children would be very stressed. Parent would be very frustrated. And so that's what really developed my interest. And the game changer was when I went to do clinical psychology. That really made me realize, oh, now their mental health problems, or all these. Now we did all those mental health problems, disorders in details. And then again, that opened my mind. So I think with the adolescent, not the children so much. This children is a different ballgame, but a lot with adolescent. Yeah, I think that would be my background in that area.
That's so interesting because some of that I didn't know, like the full pathway.
That's the pathway. I was
How-
forever in school.
Yeah, for school. You may feel that way.
Yeah.
Many of you here. With that experience, you've had a few projects in schools like your mental health literacy, looking at teachers' mental health literacies. With that experience, when you think about mental health intervention in secondary schools and high schools, what comes to mind for you as the main things we should be addressing, both from your science side and your research side, but from having spent time in the schools yourself? What are we not doing that we should be doing? What are we missing?
I always feel that the missing gap is the parental component of these children, because they will not be available. And this comes also from the frustration the children will tell you, my mom doesn't. My moms are always a problem. My mom doesn't listen. My mom, and then they are like the communication system. How do we communicate to this? So I always feel that if we had a bit of parental component, then that would be very helpful. And then maybe more in the training system of teachers would have some bit of more component, because in teacher institutions, we do psychological, educational psychology, a few units, but then there isn't anything that, unless it has changed, at least when I went, there wasn't. So we did educational psychology, but lots of how, you're taught just how to integrate discipline in class, take care of discipline in class. So I think if that component have more training so that the teachers get more know how to deal with the children, and have parents more, have components of parenting.
That is so interesting because I haven't gotten to update Anne on some of the data we've run recently. And I'm trying to remember if y'all have heard this, but we have a project in Bungoma where teachers are delivering trauma-focused cognitive behavioral therapy, and community health volunteers are delivering cognitive behavioral therapy, which Anne knows. She's been to the Bungoma site and met some of the teachers and some of the CHVs. Oh, yes, y'all do know because it's Rashid's dissertation. So one of my PhD students was looking at fidelity to the intervention and if teachers were doing it well and if CHVs were doing it well, and they are, both teachers and CHVs are doing great. And what led to kid outcomes. And this really interesting finding that makes, because of what you just said, so I'm deviating from the questions format, but we saw that fidelity, because it has a caregiver component. So we bring the caregivers, it's focused on kids who've had one or both parents die and supporting kids who have mental health problems because one or both parents died. And it's all primary schools, not secondary. But the group leaders, whether you're a CHV or teacher, you meet with the parents or the surviving parent or a grandmother or an aunt. And then the CHVs do the same thing, meet with the surviving parent or the aunts in a group. And the thing that most connected to kid outcomes, kids doing better, was not how well they delivered the child group, but how well they delivered the parent group. And my student Rashid just presented this as part of his dissertation. It just makes me think of what you just said, because I was telling Rashid, like, they're teaching the kid coping skills. They're helping them get over like the scary memories related to a parent's death. But I might guess that parents who get a very good parent support group and who do a very good job, maybe they do some of what you were just saying, which is that changes your context. That's your house and that's how you're treated. And orphans, are given lower quality food often, harder chores. And so it's so interesting to hear you say the parent stuff, even for secondary.
Yep. Yes, because our parenting styles are very different. The Kenyan parenting styles are very different. The parenting styles for us, okay, not really debating, just to show is because the parent says and the child obeys, and maybe for us, the older group. But also you find the beating is pinching, whatever the beating is, and negotiating child-parent negotiation. If you can do this, then we can agree. That is not part of the way people are. Maybe the younger parents, but those older parents, the whatever. So you find that the parent is the beginning and the end, is the one who says and is the one you have to obey. So, but now when we tell them, or look, yeah, that is okay, but it was for the older days when there wasn't much TV and all these things that shows how other parents do. And the context is also changing. Then we are saying, like, can we have parents having more dialogue with the children and find out, oh, what happened? That dialogue, then they'll be like, the children can say, oh, it's not, I can listen, I can talk, I can say something. It's not that situation where I will be, mom or dad, you just beat me. So for me, and having interacted with parents as they came for academic performance, academic, what have you, it's like, okay, you want your child to pass, but let's see how well from the time they were in primary. Let's look at the academic performance. Let's look at, do you provide also all these things? So I think that interaction, the parents need to be there. The parents must be there. So I think that would do a lot of change. That's my thought. And you find that now it's starting, like you get maybe even the church organizes, we have talks for parents, so that kind of where we have to work with school children. I think it would always be good to think of a component for the parents to be involved. And if it's on a small section, but it would be help a lot. Yeah.
I love that. I mean, I feel like, one of the biggest issues we have in the US with school-based mental health services is that the kids are all there, but the parents aren't necessarily there. And then here we had to have this kid's parents come in. And of course, sometimes they're selling in the market, they're working, they're farming. And so, can you come up to the school? But we had pretty good parent attendance mostly, but with a research project, you have a small stipend you can give someone for coming, which I think makes a big difference.
Just organizing the time, maybe from 4 when they have done most of their work, especially this Sunday school, is just organizing the time. When is the best time for the parents?
Have you seen any good examples of programs where people have been doing some of that work? Like, using maybe that hour, or is this the next grant we have to do? But like, how are, have you seen examples of people trying to do that parent work in schools?
Yes, we did. I know we did a study with the University of Washington University at St. Louis.
Oh,
they had
yeah,
a program.
yeah.
They have a study 4 hours and 4 places or something like that. And we worked with the children. It was in primary schools, and the parents came at 4 for 1 hour.
Okay.
And it was activity, and the child sat with the parent and they started looking, do we implement this? Do we have this at home? And they were interested. And they were like, we are doing something different. As we only give rules, we tell them we must do this. So I think a start like that would be very helpful. But of course, not that would be more, if you start with the primary schools, because most of the high schools may be boarding, but find a way, if we start like primary schools, then those parents now you go, they become better. The parents are like, oh, we have learned something like this. And the mothers are very good because there are so many women group. We call them chamas, so many chamas for mothers, and they get together and they start spreading information. So women become very good when they have that information. Yeah. That's
Very
what I would say. Yeah.
Well, knowing who's on, I'm wondering if I switch gears and ask you a question about our shared favorite paper.
Mhm.
Um, as some of you may have encountered, there were many research projects that were one thing before COVID and then turned into something very different once COVID started and we had in-person restrictions and data collection restrictions. So Anne and I were part of a very cool project funded by USAID and EQUIP that was going to train community health volunteers in a settlement community, right? To deliver trauma-focused cognitive behavioral therapy to kids who'd experienced violence. And we had lay trainers from the Bugoma side that were coming over and a colleague from Zambia. And we did the initial training to pilot. And then, COVID happened. Then there was going to be no more in-person training and no more bringing people from Bugoma to Nairobi, and certainly nobody from Zambia down to Nairobi. So Anne and our colleague Mathoni Mathai did this brilliant shift to a training model that we were required to do because of COVID, but is the most beautiful example of a potentially scalable and sustainable training model when we can't afford to bring people together to hotels for training, or everybody can't get on a Zoom or computer-based thing. And I say it's our favorite paper because Anne first authored this paper. It just came out in Global Mental Health, and we adore it because it's very, it's a very how do you do something. So would you talk about that a little? Because I think, seeing who's on and the fact that a lot of these folks do training, I'd love to have you talk about why you did that and what you did and the potential for future success of this kind of training model.
Very interesting because part of this, but as I read, I was like, as we got the people to the training, of course, the inclusion criteria was you must have a smartphone. And it was like, do you know how to, in Kenya, we do lots of WhatsApp communication. That's the mode of communication. It's almost like you find even people just a whole group here. We are communicating via WhatsApp, and people like, I didn't hear. I said, but you have a phone. It's taken for granted, but you have a phone. But yeah, but my phone. Anyway, you do both SMS and you do WhatsApp. But WhatsApp has become a very important easy way of communicating. That's assuming that the phones are working. They are working. Of course, sometimes they'll be dead. So when we got the community health workers, and they said, the first question was, have you ever been in a group WhatsApp, and can you be able to, so the group WhatsApp is okay. Have you ever done any training in Jitsi or Google Meet? Okay, what is that? So, so we are like, okay, we are going to show you how to do it. So Modon was the one who was very good at training and explaining, and they started, those who where they started doing WhatsApp, very interesting, just communication. Now, how does this work? And people put image, are they emojis, whatever they are called, and you've got to decode. So they were there all over, and then finally somehow along the way I thought, supposing we got all this information to show the experiences and describe the experiences, we have assumed that we can, people can just connect. And so I downloaded all those, and I pasted them on my computer, and I was looking at, and I was laughing. And I was laughing at the scenario, and I said, Supposing we got to describe these experiences, and I did the first 3 or 4 lines and I circulated and to the team, and now they were like, oh yeah, this we can do, this we can get. So that's how that paper came up. But it was the excitement of the community health workers when they were able to join the meeting. I am in. It was I am able to do it. It was very exciting, and I'm like, we've taken for granted. But I also remembered at the university when we were taught how to use the Google Meet. We couldn't follow. And then we said to give the classes, then we said we would, Modoni and another one who is very proficient in communication, we said, why don't we try and set a Google Meet among ourselves and see whether it will work? I said, oh, we were there sometimes back, and now here are these ones who are very excited about joining the Google Meet. And I went back and I said, we could have it out, and everybody was excited. And I think, as you said, is that sometimes we don't have to feel to do training. We don't have to have so much money. We don't have to carry everybody from here to Africa. We can find ways in which the people can be trained. Of course, human interaction is important. In psychology, we know that we can see the people, the faces, but then you train yourself to hear them. What are they saying behind all those things we do inside? Yeah, they are saying the words, but what is being said behind those words? That's the beauty of that communication. But then it means you can also then train yourself to read the meaning of what is being written. So I think that's one way in which we can deliver, but of course, be very supportive to the people and be able to, within that group, there will always be someone who is ahead of the others in terms of doing things. Yeah, as it happens with all of us. They'll be more proficient in technology and doing things compared to us, and so on. And yeah, it's the experience of our paper. She is very organized, and she organized the information very well.
You don't do the work, it's easy to organize it. I wasn't even there. I just got to organize it so that it could be shared.
I think Grace has a question.
Oh, yeah.
Yeah, thank you. I'm curious to hear a bit more about this program, specifically thinking about adolescents. You had mentioned that a lot of high schoolers attend boarding schools, so that parental missing gap of support might be a little bit more difficult to fill. And I'm curious, especially with the digital communication piece, if you've considered or done any work on peer-to-peer support in high school as to something to maybe bolster the parent support or potentially replace if that's not available. Or if you see that as something that might not be useful, where you might see pitfalls in that.
So with the parents in terms of using the phones, okay, it's a while since I was in schools. I'm not sure. No, it goes with each individual school. So each school might, and dependent on resources and what they have, because we have the national schools, maybe some which are have more. And also getting the proper timing for the parents to be there, because majority maybe will be in the office. And also, but also in Kenya, because there's this buying of a lot of mobiles and what have you, it could be, and there could be one way in which maybe either the school guidance, dependent on what they have, they could organize on that. The only thing they could be asking, is it within my working time? But that could also be an interesting study, which would be help and see whether, if the parents are far, and the younger parents today, so now we have the younger parents who are really a lot interested. But for primary schools, most of the primary schools in Kenya are day schools. So that would be a good area to start with. And they get to hear. So if we don't make it very complicated, they would start from there. And because I think the catch would be to start from primary before they head to high school. And if we mold them from primary, then they'll know what to do and how it should be done. And then as they get to high school, then it's possible that the parent will be saying, oh, we were in these schools and they used to, because you have parent-teacher association. So they could come up with, oh, can we try this? Can we do this? So I think it could be something which could be started and would be very helpful.
Thank you.
And we haven't done any peer-to-peer. I mean, we do a
No,
lot
yeah,
of,
we haven't here.
lay providers.
Mhm.
We do run into it. I don't know if y'all see this, but with like the kids in boarding schools, it's nearly, because we have another project that's delivering care to with Cyrus Mugo and gosh, there was a million of us on that project, trying to look at care for mental health care for youth involved in HIV clinics, and the ones that are boarders, they go to the clinic, so they just go on their, trimester breaks, and it's hard to get them, and they don't always have phone access at the boarding school. So we're trying to think like, could some of the madams or people deliver, but it's, I wonder if there are some things peers could do, and in other environments, there are clearly some things peers can do and some things you wouldn't want a peer to do, but some of the basic psychosocial support,
Mhm.
as long as you took care of the confidentiality, some peers could deliver. And you talk a lot about the confidentiality piece.
Yes, and also we do have some students who happen to be sometimes in the departments, but those ones you've got to really be careful, and they are well selected, and finding out, would the other students trust them? And if you become enemies, as it happened, are they likely to tell your information to other people? So, but we did have peer counselors. We do have peer
Right, yeah.
counselors in the school. So it needs to be the training, at least lots of confidentiality, and provide basic support so that, and they can lead this person to this counseling teacher.
Yeah.
So that would be important, very helpful. But we do have
Yeah.
peer counselors.
Nice. That makes a lot of sense with the confidentiality issues, that of course it can't quite be the proper talk therapy, but like emotion regulation strategies and resource finding, that makes a lot of sense. Thanks.
I'm going to step back really fast to one thing on Ann's, and Leah, maybe we can even stick it in the Zoom chat and then we can send it out, the global mental health paper that Ann's the first author on. But the reason I wanted to just highlight one thing from Ann's paper and this work, too often if we try to use a technology solution, we do not give the people that need to use it enough time to build confidence and feel, and then we say, well, why didn't they show up for the training? Like, somebody didn't know how to use it. They didn't. So the most beautiful thing that they did is they planned for a training and they started engaging people 6 weeks before. And in the group WhatsApp that she was talking about, they were collaboratively trying out different platforms, and people got to vote and say, I mean, not literally vote, but, weigh in and say like, no, I couldn't get on that one. They had all these practice meets well before the training where people tried to log on, they reported their problems. And then they set up plans for and training for how do you mute, how do you find a quiet space, how do you make sure your battery is fully charged before you start. And then they also did a neat thing, because some of the older CHVs with smartphones still just couldn't quite figure it out. And so even with the COVID restrictions, everybody could get on their own, but they found one room in a health facility or somewhere where those people who needed help to get on came together and logged on together. And we rarely see that kind of pre-planning for a training. We just say, oh, so-and-so couldn't log on. That could be a brilliant counselor. Just because she doesn't know how to get on to Jitsi or Google Meet, we're going to lose her brilliance. And so that was one of my favorite things. And so, we lay out the whole time, because it really does take a lot of time to use technology. And because it wasn't computers, it was mobile phones. We did rule out people who didn't have mobile phones, but increasingly everyone has one, and it's just going to keep, happening. And so it just seemed like such a scalable thing. And then we were sharing with Keshet, they also set up the training to be content in the morning and the same content in the afternoon. So that if you lost your network, you just joined in the afternoon. If you didn't really follow it and you didn't understand in the morning, you could get a second dose in the afternoon. And so we just had the trainers deliver the same content morning and afternoon, because you can't problem solve network and power challenges, you just can never get around that. And so it's just, if Lee is able to get into the chat, it's just a beautiful model. Because otherwise, and I think they felt, you'll see in the paper, you'll see the WhatsApps that she put on her computer and then we put in the paper, just that they felt this confidence in part of the whole process before the training ever started. So there was this great group dynamic before day one.
It's true. And considering that in developing countries, how we always have power outage, there's no power. So it does allow people to participate at different times. To either morning, but that also is dependent on the amount of time that is available in the planning, the amount of time that is available for the grant, and so many factors are coming. But the point is that it allows people who might not be technologically high, but have important information to join and participate and give in that which is required.
Your tech skill should not be a barrier if you don't need to use tech to do your job. Like if you need to counsel people, but yet you couldn't get the job training because of tech. So it's just the most beautiful example I've seen of that kind of process.
Okay.
Sorry, maybe I may want to ask, is it the right time to ask a question?
Yeah.
Okay, so thank you. So I really want to ask about maybe if you have had experience where like a child or a student's behavior in school emanates from the parent, and how have you dealt with that?
In schools, like you found that most of the time where there was what was deemed as very serious behavior, the child was sent home or the parent was called. In fact, in most cases now the parents are called. The times how the child would be sent home, go and bring your parent, a bit fading because your child disappears along. But now in such a case where the child is felt that this behavior, and especially if they had been given a warning, and then they will be told to bring the parent, and that's common, deemed on the seriousness of the behavior. And then from there, they might not say that it came from the parent, because the parent, you'll be like, how do you know? You just feel like, the school children are very, sometimes, of course, as the adolescent, they will try to be a little bit cunning and not say. But teachers will somehow get to know, they'll get to know that and assume whether it's correct or not correct, because the behaviors will be, you get a little bit of home if you pay a lot of attention to what the child is saying, and you call the parent. Well, even if it came from school and is very serious, they call the parent. That's one of the things that happens in schools. They call the parent, and the parent comes. If they are called, they come. If they are not coming, then they'll tell the child, go and come when your parent is coming. Yeah.
And maybe just to add one thing onto that, because this is also what you're mentioning, is like when the problem may be something the parent's doing and not the child. Is that also what you're saying?
Yeah.
It's really difficult because usually if parents have a problem with the child, they want you to do something with the child. And if the parent maybe needs some different strategies in the home to manage the kid's behavior, make them better behaved, not so much to be at Mbwayo, but actually doing the right thing and maybe less anxious, then we usually want to work with the parent and change the parent's behavior, but that's not usually what any parent wants to hear. So I feel like there's some tricks, and in our program, we're next door to you for the clinical psychology, but some of our tricks are like just talking about how we can help parents use different tools, like normal tools might work with the kid. Your kid might need some different tools. We're hoping to train you in some different tools that you can use with this kid, because any parent would be defensive if you're saying, that they're the problem. But sometimes, we have a screwdriver and we need a hammer, or we have, and so I think usually we've tried to come at it that way with parents, but they often need intervention. You can't change what the kid does to make them feel better. You need to change the environment.
Because there are some situations where the parent will deny that my child is not capable of doing this.
Yes.
Yeah, my child is very good at home. Yeah, I know. So.
And that's the way the parents do. That's what they say, and that's what they will do. But also it depends on many parents, actually, you find they will not be defensive. They will accept, and they will even start saying, I've always told you, you have not heard. Either it's because they do not want their child to be sent away, but 3/4 of the parents are actually aware of some of the problems of their child. More than 90% are aware. And that's how you find some parents are happy when the schools are opened. Let them go back to school. Majority of the parents are aware of their children's misdeeds and misbehaviors. And so they are even happy, and they'll come and say, in Kiswahili, mwalimu saidia, teacher, please help. I've talked to this child. So they're happy also to get help on how to deal with the child.
And a lot of our evidence-based interventions, include some kind of parental involvement for these reasons. It doesn't mean parents always want to take part, because they might say, I don't need to be there, but.
So let me ask you in relation to, you've mentioned about the Bugoma study, and in relation to the parents as what he's asking. Did you notice from the interventions, were the parents or the guardians happy to attend? And were there mentioned from the teachers, I'm assuming the teachers, or a report from the guidance teacher that the parents or the guardians said, oh, there was an improvement in the performance or behavior of the child? Was there something reported, or what was the whole experience?
Yeah, that's a great question. At first, I think because it's not a common expectation to ask the parents to come up to the school, for an 8-week meeting. I think at first people were a little hesitant, and certainly when teachers would ask, they might think it's more like you're up there because you're late paying your school fees, or, your child has a problem or something. The CHVs, because they were already in communities. So the CHVs delivered the groups in schools too, but parents seem to have some hesitancy, and it would, either be a surviving parent or it'd be an aunt or a grandmother typically. But once they came and got a chance to be with other guardians and other individuals who were trying to support a child who'd been orphaned, they really valued the time and experience that they had, because they shared ideas about how to deal with misbehavior. They shared, oh, sorry, I shouldn't use,
Taking care of whoever is responsible for taking care of the
Yes.
child.
whoever the family member is standing in. And we use guardian to just include the caregiver, I should say caregiver. But once they were there, a lot of them felt alone. They have an extra mouth to feed. If it was like an aunt who took a kid in, they didn't know how to help with the child's sadness and fear around the death and loss, and how to deal with difficult behavior. And so I think once they got there, and the fact that it was a group intervention and everyone was dealing with the same problems, the caregivers loved it. So we have a paper describing their experiences, and their only complaint was that it wasn't longer. So after people kind of not wanting to come, it was 8 weeks. They said, couldn't this be 12? Or, could we have more time together? And part of it was, they shared strategies. One of the very interesting things was that, if it was an aunt, a guardian, or surviving parent, not only was their child experiencing grief, but that person had lost a sister, a wife, a daughter. And so we tried to talk about the strategies for the child's grief and fear, But the parents or the aunt or the grandmother was saying, I also don't want to use their plate, or I also avoid the grave, or I don't want to, I have trouble remembering the happy times because it reminds me of the death. And so they would use the strategies for themselves, and then you would learn to support the child better because you used it yourself. And some of the strategies were for bad behavior because, some of them were saying this child is not going where they're sent. This child is not doing their homework. And so they use those strategies. And so that was kind of the parent and guardian experience. Not all of them come, and eventually we're going to be able to look at outcomes, but if you can get them there, it almost makes me want to, give people some small amount of money to come the first time so that they can see what it is, because they don't have a sense of what it would be like, and then they would keep coming. We were able, because it was a study, to pay some small amount to support their transport, because in the rainy season, it was very hard to get there. But from the teacher side, yeah, so the teachers would say two things as they delivered. One, many of the kids, I could not get the money to get the school data. I really wanted to get performance data because many of them would say, this child was at the bottom of the class. And now this child has risen to the top, because I think their minds were freed to focus on their studies once they weren't so sad and worried about death. And then the teachers also talked about using what they'd learned in this group to manage behavior of other kids in their classrooms, and that their head teacher or their deputy teacher, after they had delivered these groups as part of our study, saw them as an expert in the school, and so would recommend them for other roles. And so it ended up being, they built this expertise, but they were also seen as experts in their schools. Because we needed more in the small rural schools where you might have like 8 teachers. We needed more than just the guidance teacher. And so now we were like building the mental health expertise in the schools, and the head teachers and deputy teachers would use them that way. And and I'll just add this, the kids would say, from what your mental health literacy, the kids would sometimes say, my teacher is less harsh. Like after the teacher had learned these lessons, because they figured out a better way to discipline or manage behavior, and they would say she's a little less harsh.
That's very interesting, because once you get the skills, once you get to know what is, there are many things happening. Then the teacher even learns. It's not just the being so harsh that is going to help the child, that you also have children, and the children can give you a problem. Is that how you'd want your children to be treated? Because you also always ask the teachers, you are parents, tell me, you as teachers, when you're harsh like this, when your children perfect, or aren't they just like these other children? The difference is that now these children, sometimes the parents are not there. They are not there. They are not there to give them ways. They are not there to show them the way. And that also reminds me in that work we are doing of the parents and the children. One parent called me and told me, you know what, Mwalim, my child is very happy because the rules that we made and stuck in our sitting room, even Baba, Dad, follows those rules, and we are very happy, and the child is very happy because the rules were only for the child, don't do this, don't do this. But now when they sat and they did the rules for all of them, something not common in our setting, and now they are, Daddy, you always come late, please be coming early and helping me to do assignment. So I think with where we would have more work, even to involve the parents, more to involve the teachers, I think our learning and the students will really benefit a lot, because first I become a better teacher, I become a better parent, and then I'm able even to realize, to differentiate, are these just normal growing behavior, and I can tell you, and are they serious behavior for which I'll know whom to involve. I think that's what I would say. It would get more work on that. Involve the parents, involve the teachers. And it spreads. These are people coming from the larger community, especially in day primary schools. They are coming from the neighborhood, and the community improves. That's what I would ask. Any other? So
I have a question.
yes.
So, in Bungoma, I just want to ask, are you dealing with, is it urban setup or is it rural? And then the other thing is that it's good you are talking to parents and teachers. Because having grown up in Kenya, I think it's just people want younger people to go through what they went through. Mom was harsh, this was an all goes on. So I'll have to treat you that way,
Yeah.
surprisingly, which is which is not in order. And then the other thing is that this desire to excel, and you're already touched to it without providing adequate resources and also just diverse way of excelling. Like excellence, I think in most of our setup is for a long time to be this academic excellence, which puts things into pressure.
Yeah.
And then in terms of what we are doing, do these kids or the children you are dealing with feel singled out, or parents feel singled out?
That's a great,
Yeah.
it's a series of good questions and I'll answer. Oh, in 1 minute, I'll answer them in 1 minute. And I know people may need to go on Zoom. Thank y'all for joining very much. Check out Anne's paper for sure, because I think it applies to a lot of the work everyone is doing. Wait, let me go to the first part. Oh, urban, we have urban, rural, and peri-urbans, because it was important to us in the first, we're on the second or third large grant, because something that works in urban areas may not work in rural. So we have schools that have 8 teachers and a school that has like over 50 teachers and everything in between. And because the grant's a little bit implementation science, or a large part implementation science, we're studying patterns of how a school with 8 teachers can be successful and how a school with over 50 teachers can be successful. And they can both be successful, but it looks really different. And we're using coincidence analysis to do that, which my student Clara Johnson is an expert in. And you may know Claire Guayachoye, who was here before. Did you know her? She's a PhD student, also an expert in this. And it lets you look at recipes for how people can be successful with very different organizations. And both my students took Clara's class this quarter. So we have the whole range of urban all the way to rural. And at least for the analyses we've run so far, we're looking at child outcomes. By the way, with teacher and CHP delivery, they're great. The effect sizes are like nearly 1.0. They're doing an amazing job. They're trained by lay counselors in Bungoma who trained them to do the intervention. And the outcomes are great. Oh, and now I'm losing your question. Hold on. Oh, urban and rural doesn't predict success. That's what I was going to say. We're not saying that like the best outcomes are urban or rural. And then in terms of the pressure in the academic success, because our focus has been more on, the impact of losing a parent to death, I think we're helping relieve them of a burden that probably inhibits their ability to achieve academic excellence, but we haven't focused on the pressures. But I think those pressures are so real, like some of the work that Prerna did in New Delhi, like the academic pressures for excellence is the biggest stressor for children, like how well you're doing academically. And that makes it hard to do well when you're that stressed out. So I don't know if that's what you were asking about, the academic pressures, like some support to do well without feeling burdened by the pressure. But it does seem there's some data in the US and I wish I'd gotten school records. I think I could still figure out how to do it, because they're all in the schools. I just need the money to do it. But I'd like to see the change in ranking for these kids who got the intervention, and how it might help, because then we have the proof that mental health interventions can help with academic progress, but probably there are interventions needed just for the academic stress too.
The last question was about stigma.
Oh, and the last one was about stigma.
Yeah,
Was it okay, tell me what that one was again. Yeah. Thank you.
Who was selected to participate in this intervention?
So this was going to be one of my questions for Anne, and then I asked her other things. So in primary schools, I think it's a little bit easier than secondary schools. They offer this as a club, like any other club in the games hour. The school was already doing some programs specific to children who've been orphaned that were around farming, sanitation, and they called them orphan to orphan clubs. So they used that same avenue where kids were used to it and it didn't have any stigma. It was just support. And then we put this mental health intervention into that slot. When Anne and I have talked, it's clear that like in secondary schools and in Nairobi County, you couldn't do this. We potentially were able to do it in Bogoma South because they already had these orphan to orphan, I think they're called child to child clubs and they, because this wasn't our idea, it was our partner's idea that already worked. They put it into that. So it didn't have the stigma. In fact, there were kids wanting to get into it because they would hear the lessons that kids had learned that apply to everybody, you know, how to calm yourself down and how to think in different ways to feel better. But I think, you know, that's one thing we've talked about. I think it'd be very different if you didn't already have child to child clubs and if you, and it was secondary schools and you didn't do it in the games hour.
Thank you.
Yeah. Thank y'all for coming. I'm gonna pause this because I want people to be able to go. I don't want anyone to feel like they are gonna be rude by leaving. So I'll say that is the official end of the talk. Is that okay? So that people
That's
need to
fine.
go and then.
Yeah, and we have the room for a little while longer if people want to stay and ask a couple more questions. And if you're, I don't know, if you, I'm not sure what your availability is.
Yeah, I think we're free for a few. Yeah, we're free a little bit longer. But people can feel free to go and consider that the end. And thank you for coming. Bye, Renee.
Thank you so much.
Hello, Leah. Let me share the paper with
I
us.
did share, oh yeah.
On email?
Oh, I'll share it on email, absolutely.
And don't send the PDF, send the link, because you know, that's how you always do it, because then you get more clicks. See, at least I know that about publications, because then your metrics look better that people are
Okay,
accessing your paper.
good to know. I'll send the link.
Thank you.
I won't download.
And it's open access, so you know, Global Mental Health is an open access paper.
So I think someone asked about peer-to-peer intervention.
Mhm.
We have colleagues that doing the same thing from Ampath, Moi University in Kenya, who tried peer-to-peer intervention
yeah.
through WhatsApp.
How did it work?
Saying it was comparable to in-person, using more of interpersonal therapy. Yeah. But it's good is that the interesting thing is that what I get is that people maybe for so many years, parenting was taken as a natural thing.
Mm-hmm.
And then people struggle with it. Nobody wants to ask for help. And like I've seen in Kenya, sometimes I look back, parents give up on their children when they're just adolescents. Then the life takes a different turn. Then it's just the end of, you could have had a very bright person, but because of adolescence, a few misdemeanors here and there, which could be psychological in nature.
Yeah.
You are left on your own, and that's how life takes just a different tangent. Then you end up having a less productive nation.
Yeah.
I would say, I think we are having some changes now because there's a lot of talk about parenting on radio, on TV, and the realization, especially when the mental health issues started being made even from a national level. Now mental health is all over, and there's that. So, and then the younger parents in churches and in places, they are also always talking of how to bring up children. There are these talks which are happening. So I think there's a little bit of improvement as opposed to this is how I was brought up. We were brought up being beaten, and therefore we were beaten. I can tell you for that. Beating is synonymous to it is spare the rod and spare the child. But something totally different here. So we find that at least there is a lot of talk. There is a lot of, and the schools are making an effort to give talks to parenting, to parent, to what have you. There's a lot of improvement. We have not reached there. And I'm also thinking there's this curriculum-based CBC, competence-based. And I think that is also changing because now you're able to move. I don't know how it will take in the high school, it will look like in the high school. But the realization that your skill can even make you a millionaire, you do very well. It's not only being academic, being a lawyer, being a doctor, which our parents were really like, must be a lawyer, must be those top things. And that is cream for very few people. So what else can the parents do? And the children do, and they get supported by their parents. So I think we are having a change now, and it might be slow, but we are moving. Something else is that maybe fewer jobs, unemployment could also be changing the ground, because okay, you're having high unemployment rates. So if you have your skills, then you can do your own business and help you to earn. I think I'm seeing a change even in the conversations and in talks, and they're saying, and when they were saying Kiswahili, kazi ya mikono ni so work with your hands is not bad if you're able to, and you can still survive. Yeah. And then also a number of people, even with degrees now, are turning into things to earn them a living, not even related to the office. Things they wouldn't have thought. So I think that's what is changing the ground. Takes time, but things are changing. Yeah.